Hi, I'm Dr. Adam Barnard. I'm a clinical director of balanced physical therapy Prunedale and a physical therapist out here to talk about sitting today. Do you sit a lot for your job? You might work at a desk, or you might drive, or even have a really long commute. So I'm here to talk about what that can do to your spine, and we have a model here to demonstrate a couple things for us to do in order to prevent any back pain or anything else occurring as a result of that. So when you sit, we want to maintain the spine in what's called an S posture as opposed to a C posture. So Jackie here is maintaining her spine in the normal curvature. She has a little bit of an upper back curve and a little bit of a lower back curve right there. What we don't want to do is slump down and dump it out and sit in what we call a C posture like that. Now what that can do to the spine is it puts more pressure on the front part, the anterior aspect of the intervertebral disc. So your disc has more pressure in the front and less pressure in the back. Just like a water balloon, if you push on one side, it's going to want to push out the back right there. And if you'll take a look right in here, that can impinge or compress upon these nerves that are exiting out the back of your spine. Your sciatic nerve, for example, resides back there. It arises from 5 different levels of your lumbar spine, converges into the largest nerve in your body, and runs down the posterior aspect of your thigh. So when you sit a lot, such as if you're driving, if you could go just like this, now you can see a couple areas which may become tight. So in her upper body, the chest is going to become tight from being in that forward flex position. Her upper back is going to become weak because it's a lengthened, non-contracted position. Also, her hip flexors, the front of her hips right here, are going to become tight. Her low back is going to become tight. She would probably need to focus on the strengthening of her abdominals, the anterior aspect of her trunk right here. She also needs to strengthen the glutes, so that's the posterior aspect of your hip down there. Going farther down the chain, she's probably going to be a little bit tight in her hamstrings, those muscles that run along the back of your thigh, and then maybe even in the calves. So what do we do for this? Let's take a look at a couple stretches that you can do, and then we'll also go over some exercises that you can do as well. So first off, Jackie, if you could stand. To stretch the chest, if you don't have a doorway, what you can do is take your fingers behind your back and go ahead and pull your hands down, and you're going to open up the chest as wide as you can. If you want to go a little deeper into it, you can lift the arms up in the back. You'll feel this stretch all on the front of your chest and the front of the shoulders, those muscles that are getting tight when you're sitting down at your desk. Now for the next one, we need to stretch the hip flexors. So Jackie can do what's called a standing hip flexor stretch. You may know it as a calf stretch, but take it real wide out there. Yep, and then you want to drive the back heel down into the ground. You can put your hands on the front of the thigh for stability and lunge into that front leg. You'll feel this in the calf, but what I want you to do is keep your abs tight and push your hips forward and down so you can feel that in front of the hips right there. Very good, thank you. Another stretch you can do from the comfort of your desk chair would be for your hamstrings. So if you could take a seat, please. Go ahead from the front of the chair, kick one leg out straight on your heel, place both hands on that straight leg, and bring your chest down to your knee. You want to make sure you don't hunch over like that, and you'll feel a real good stretch in the back of that right leg right there. So those are some main stretches I'd like you to focus on. Make sure you're holding them at least 30 seconds and don't pulse into those stretches. Now for a couple simple exercises. So we need to strengthen the upper back, the abdominals, and the gluteals. So first, for the upper back, Jackie, let's have you go down to a prone position right here. This may be tough at your desk, but I'm sure you got a carpet or someplace comfortable you can do it at home. Place your arms out like a T, so straight up. You're gonna lift your chest up and pinch your shoulder blades together. Make sure you squeeze right in here. If you're doing it right, you're gonna feel it right there, and probably a little bit in your low back. You can go down and then come back up again. You can do sets of 10, make sure your paws at the top, or you can hold for at least 30 seconds to develop that endurance strength. Okay, very good on there. Now we need to strengthen, the abdominals. So go ahead and roll on over, Jackie. So for the abdominals in the front, what everybody refers to as a six-pack, you can cross your arms in the front, keep both knees bent, and I want you to exhale as you lift your chest up off the floor. Go ahead and do a couple of those, Jackie. You want to try to keep the back flat, neutral, and not curl it over like that. So Jackie's doing a good job leading with her chest, going up to the sky, and she probably feels it right in here. Good. Okay, and then for one last one, we need to strengthen the glutes. So go ahead and stand on up, Jackie. And everyone's favorite, we want to do the squat. So you can do, you can touch your buns to your chair. Yep, you want to make sure your spine maintains a neutral alignment. She's not sticking her buns out, she's not hunching over. She's pushing through her heels, and she's pushing her glutes together, or pushing her glutes forward at the top, squeezing her buns. Very good. And you can go ahead and relax, Jackie. So I'd recommend getting started there. You want to stretch the muscles that become tight as a result of sitting, and you want to strengthen the opposing muscle groups so that you can better develop your body symmetry that has been affected due to your sitting. If you found this video interesting, you can give us a follow on Instagram at BalancePTMove, or you can visit our website at balancept.com. Thanks so much, and I'll see you on the road.